This morning on today's checklist, we are taking a closer look at hair and scalp health with some of the best ways to care for the hair that you have and to help men and women struggling with hair loss. This is such an important topic. So many people are dealing with balding or maybe they're thinning a little bit. So joining us now, we have plastic surgeon and hair loss specialist, Dr. Michael Wolfeld. Good morning to you.
Good morning.
This is a hot topic.
It's a very hot topic.
All right, so let's first start with, even just breakage.
Right.
'Cause I guess before you get to those other things, just how do you protect the hair that you have? Let's talk about that.
Right, so different things may damage your hair. And here's some very important things to keep mind of. So if you're going to brush your hair, be gentle.
Yeah.
Anything too rough or strenuous can maybe damage and break your hair.
And, there's a thing going around where they're telling girls if you want your hair to be longer, thicker, to brush it. And so kids are just brush. And adults are brush, and you're making it worse.
That's right.
Yeah.
Overbrushing can be harmful.
Okay.
You want to avoid tension on your hair, so any tight hairstyles are no good.
Yep.
Avoid any very hot treatments. Hot hair blowers are not very good. And if you have split ends, it's good to trim them so they don't propagate and affect the rest of your hair strands.
Okay, so now let's talk about with Craig, thinning.
Yeah, thinning. Chanel just mentioned it. Thinning, shedding as well. Some
That's
folks,
right.
You're in the shower, you look down on the drain, you get a little concerned. At what point should you actually go and see a doctor like yourself?
Yeah, so if you notice your hair thinning and you losing more hair falling out, that's a good time to come in and see a specialist and to see what may be causing that. Now, genetics is one of the most common causes of hair loss.
Is it true? I feel like years ago I heard that if you lose your hair, or if your mother's father was bald, then there's a great chance that you're going to be bald. Is there any truth to that, or is that a myth?
That's not true. That's a myth. So it can come from either side of the family. So you really have to look at both sides of the family to see where you may fall.
So besides genetics, what else contributes?
Yeah, so there's stress. Any stressor on your body, whether it's recent procedures or illnesses, can cause a shedding of hair. There's autoimmune diseases that can cause your hair to fall out, and also vitamin deficiencies. That's something that you should be aware of as well.
Certain blood work that folks should be asking for when they go see their doctors?
Yeah, absolutely. So, we look at vitamin D, iron, zinc, but especially hormone levels may be important, especially for women, young women and older women. Thyroid deficiencies or overactive thyroid, that can also cause hair loss as well.
Okay, I've already learned a lot. Mr. Wilkers.
Al needs to learn.
The basic. You see, God only made so many perfect heads. The rest are covered with hair. You got to take care of your scalp, right?
That's right. That's right. So taking care of your scalp is really important. So just in your daily life, from the products you may use, from sweating, from just grime from the environment, may build up in your scalp. So you want to really cleanse your scalp.
Right.
You may want to exfoliate your scalp. Massaging can help to really clear your scalp.
Do you really need all those fancy shampoos and stuff? Can you just, what's the deal?
Really, just a simple shampoo that cleanses your scalp and you can massage your scalp. There's a lot of things available over the counter in the office. We have something called, it's a hydrofacial, which is a facial for your scalp that can, it's a Keravive treatment that can really cleanse the scalp, exfoliate it, and really get your scalp looking and your hair looking much nicer.
All right, thanks.
All right. Do you hit a point where it's too late, or is regrowth a possibility?
So when we talk about regrowth, if you have hair and it's thinning, there are options and treatments that can really help to thicken your hair and help to preserve your hair.
Okay. What kind of treatments are there?
So there's some over-the-counter treatments and there's some in-office treatments. So over-the-counter, there's hair supplements. One example is Nutrafol, which is a, this is it right here. It's an over-the-counter vitamin supplement.
Oh, so you ingest it?
You ingest it.
Yes.
It's oral, it's all natural, and it's you can get over the counter and it can work. There's also Rogaine, which is minoxidil. That's over the counter
for men
as well.
and women.
For men and women.
Okay.
It's a topical solution or a foam. They also have now oral minoxidil that is a prescription pill. The oral is off-label, but it may help. So if you're someone that may have other medical illnesses such as heart problems, blood pressure, check with your doctor beforehand.
Then there's injections too.
There are. So there's what's called PRP, which is platelet-rich plasma injections. That's really a treatment.
Works.
Yeah, it's a treatment in the office, and it uses your blood and the growth factors from that, and it can really help to thicken your hair.
Does it hurt?
It's slightly uncomfortable, but it's manageable.
But do you have to keep doing it for it to work? That's the only thing with all of these things. Like once you stop, do you lose your hair again?
That's right. So the key with any of these treatments is that you have to continue using it.
For the rest of your life?
Well,
if you want hair.
Well, yeah, if you want to keep your hair.
Or if you want to look dashing like
out here. You don't have to.
Or any of our crew members.
We've got lots
Here, okay, here.
Oh, that's
here.
true.
Joseph over here.
Mason,
So
Mason's
if you
awesome.
notice, there
Oh
you
my
go.
God, you're right.
Yeah.
We stressed you guys out. We
Hey, look at Tay Diggs. Check out Tay Diggs.
gotta have him.
And look at Kareem. I mean, come on, that's the deal here. What we're talking about.
It's the cool thing today.
There you go.
Yeah.
Dr. Wolfeld, thank you so much for joining us.
Thank you very much for having me.
Hey, thanks for watching. Don't miss the Today Show every weekday at 11 a.m. Eastern, 8 Pacific on our streaming channel, Today All Day. To watch, head to today.com/allday or click the link right here.